So one of the things that we would ask you to think about is what is a principle that you would like to change in those scenarios. If you're having this conflict or problem with communication, again, very common. We all struggle with it to some degree. And I really appreciate what Lauren is saying about that inner conflict as well as the external conflict, especially when it comes to expectations, because we often have a lot of expectations that we are trying to manage in terms of what people expect from us, what we expect of ourselves. And so part of that is really recognizing what is in our circle of control. So the more we can identify what's in our circle of control, then we can start to actually establish those boundaries. So an example might be, Lauren, and I don't know if this is part of it for you, but I know for me, it's um, I really want to make sure nothing bad happens to people, as an example, to my patients. Well, I only have a certain amount of control over that. I have control over what I can do. I don't have control over their behavior, their response to information that they receive or education they receive, or whether they take their medications, appropriately. I don't have any control over that. And yet there's this expectation internally of I don't want anything bad to happen. So how do I manage that? So part of that is recognizing I don't have control over all these factors and recognizing, am I doing my best? And if I'm doing my best, recognizing that can then in of itself start to help manage that expectation a little bit differently.